My name is Hannah. I'm a social worker and sex educator with Hope Clinic, located in Granite City, Illinois. Today, I'm here to talk with you about medication abortion. Medication abortion is a way to terminate an early pregnancy. It involves the use of two medications, one 200 milligram tablet of mifepristone, followed by 4 200 microgram tablets of misoprostol. Mifepristone is a tablet that you swallow. This pill blocks the hormone progesterone, which stops the growth of the pregnancy. Some side effects of mifepristone include nausea, bleeding, and cramping. Though most people report mild symptoms and usually they don't last too long. After taking mifepristone, we recommend waiting somewhere between 24 and 48 hours to take misoprostol at home. Misoprostol causes the cervix to dilate and the uterus to contract, inducing what would happen if you were to have a miscarriage. Misoprostol is a medication that is dissolved, not swallowed. There will be 4 tablets. What you will do is you will place all 4 tablets, 2 on each side of your bottom gum line, and let them sit to dissolve for 30 minutes. These pills usually don't taste too bad, but they could be kind of chalky and they may make your mouth feel dry. After dissolving these tablets for 30 minutes, swallow anything that is remaining. It is important not to eat or drink anything while these tablets are dissolving, but before and after is fine. An alternate way to take misoprostol is by placing all 4 tablets in the vagina. Once you've placed 4 tablets in the vagina, let them dissolve. Do not remove them. You may place these tablets immediately after taking mifepristone or anywhere between that time and 48 hours later. A variety of factors can dictate when misoprostol is taken. Your provider may have specific advice based off your situation. Side effects of misoprostol include bleeding, cramping, and feeling sick. Bleeding can vary. For some people, it's moderate, and for some people, it's heavy. Bleeding could also include clots. Small clots or large clots, even the size of a lemon, may occur. Cramping or pain is another side effect from medication abortion. This is a sign that your uterus is contracting and that your cervix is dilating. Discomfort varies from person to person. For some people, it's not so bad, and for some people, it is more intense. For most people, a medication abortion feels like a very intense period. You may experience a slight fever or chills, and some people will have nausea, vomiting, diarrhea, or just not quite feel their best. Research indicates that medication abortion can be effective beyond 10 weeks of pregnancy. For patients further in their pregnancy, we would recommend taking a second dose of misoprostol tablets. These tablets are taken in the exact same way as the original, they're just taken 4 hours later. Taking this additional dose may cause an increase in symptoms, but it is far less likely that you would have an incomplete or failed abortion. After you take misoprostol, it's important to rest. We'd advise that you stay home for about 24 hours, take it easy, stay hydrated. It's also a good idea to have a phone on you in case you need to get a hold of your healthcare provider. For more information on how to manage any discomfort you may experience, please see our instruction sheet. Hope Clinic provides a 24-hour emergency number if you have any problems, questions, or concerns. The following are reasons why we would want you to give us a call following a medication abortion. While heavy bleeding is normal, we would want to know if you began to soak 2 pads in 1 hour for more than 1 hour. If it happens once, that's okay. If it happens twice and you're still having heavy bleeding, give us a call. If you are experiencing such intense pain that any medication prescribed or prescription strength ibuprofen provides no relief for your cramps, and those cramps last beyond 24 hours after taking misoprostol. If you have a fever of 100.4 degrees or more, 24 hours after taking misoprostol, your medication abortion should be complete. If after this time you are experiencing nausea, vomiting, diarrhea, dizziness, fatigue, or just feeling really, really sick, if you experience no vaginal bleeding within 24 hours of taking misoprostol, this would be a good sign the medication was not effective. It is important to follow up to make sure that your abortion was successful and that you are no longer pregnant. Follow-up methods may vary depending on your provider's preference, your length of pregnancy, your health history, and your access to healthcare providers. Follow-up methods could include having a blood draw on the day of your appointment, followed by a blood draw several days later to check your HCG levels to see if they're dropping. Follow-up could also include a transvaginal ultrasound with a healthcare provider 1 to 2 weeks after your medication abortion is complete. This follow-up could also include a remote follow-up, monitoring your symptoms closely and taking a urine pregnancy test 4 to 5 weeks after taking your medication abortion pills. Medication abortion is extremely safe and effective. The biggest risk with a medication abortion is it not working. We know that between 2 and 7% of people having a medication abortion, it could fail for. This risk increases with gestational age. So at 6 weeks, it's less likely to fail, and at 9 to 10 weeks, it's a little bit more likely to fail. Infection and too much bleeding are possible. These risks occur in less than 1%, or 1 out of every 100 people having a medication abortion. Complications of and treatment for complications for medication abortion are identical to that of a miscarriage. After a medication abortion, it's normal if you have bleeding anywhere from about 2 to about 6 weeks. This bleeding can start and stop, could be medium, could be heavy. It's also normal to have cramping for roughly a week. Most people will get their menstrual cycle back somewhere between about 6 and 8 weeks after having a medication abortion. Thanks for watching. And remember, everybody loves somebody who's had an abortion.